Guys, welcome to the second lecture of week one. This is less of a lecture like our very first one and more of an extended example of how medical terminology presents in real life. So we are going to walk through a case study to make sure that we understand all of the important components of our introduction chapter and just to better illustrate how we use these terms and why it's important to understand our prefixes, roots, and suffixes. Okay, I know you guys can read, but for pronunciation purposes, I'm going to go ahead and read this out loud. A 23-year-old woman presented with a 10-year history of recurrent breathlessness and cough. Her medical history was unremarkable except for asthma, which was under control. General physical examination was normal. Routine blood investigations were normal. Chest radiograph revealed mediastinal shift to left with volume loss of the left hemithorax and elevated left hemidiaphragm. Sputum Zeal-Nielsen staining for mycobacteria and bacterial culture were negative. Contrast-enhanced CT of the thorax revealed a right displaced tracheal bronchus, a left pulmonary arterial tree with small branches, a left bronchial tree with reduced caliber, reduced volume of left lung and mediastinal shift to left. The right lung was hyperinflated and herniating to the opposite side. The three-dimensional image reconstruct clearly demarcated the above findings. CT features were consistent with left pulmonary hypoplasia and a coexisting right tracheal bronchus. Abdominal and pelvic sonography, ECG, and echocardiogram were normal. The patient was managed symptomatically with inhalational bronchodilators and expectorants. She was advised to continue medications for asthma and was advised regular follow-up in view of possible infections and complications. So if you understood all of that, you're ahead of the game. If not, hopefully by the end of the class, that will seem like an easy thing to understand. But this is a perfect example of why I said medical terminology is applicable to all of us. Imagine if you were this patient and you're looking at your MyChart or electronic medical record and you're reading this report and wondering what in the world is going on here. So let's go ahead and break this down more and do a little bit of practicing in terms of identifying medical terms and applying them. Okay, so I want you to pick a number 1, 2, or 3. That is going to make more sense when I change the slide. So you're going to work on column 1, 2, or 3 for this activity. And I want you to record prefixes, suffixes, and word roots that you find within your column. So go ahead and take your time, read through these sections. Like I said, just pick 1, 2, or 3. You can circle back to the other sections if you want some more practice. But for right now, just read the initial 1, 2, or 3, and write down all the different prefixes, suffixes, and word roots. So if you're listening to this, go ahead and pause it until you finish your activity. Okay, go ahead and compare your answers to the ones here. See if there was any that you had that aren't here, or if there's any on here that you missed. Remember, we're not just talking about prefixes, suffixes, and word roots. There's also abbreviations. I know I said do prefixes, suffixes, and word roots just to highlight the abbreviations matter too. And let's just highlight a few of these. So graph, meaning a measure of something. So in this case, it was a radiograph. So that's another word for an X-ray. CT stands for computed tomography scan. That's almost like an advanced X-ray. Al and airy both mean pertaining to. Hyper means in excess. Hypo is the opposite. That means below or sub, not enough. Plasia means growth. Co means together. So as you can see, you can mix and match all of these words to tell the full story. Okay, to continue on with this case study, so abdominal and pelvic sonography, ECG, and echocardiogram were all normal. To treat the patient, she was managed symptomatically with inhalational bronchodilators and expectorants. She was advised to continue medications for asthma and advised regular follow-up in view of possible infections and complications. The diagnosis is coexisting left pulmonary hypoplasia and a right tracheal bronchus, meaning a displaced tracheal branch, in this case to the right. For some additional practice, you can also look at the med terms in this wrap-up slide. Okay, for those of you in the online asynchronous section, you don't necessarily have cards in front of you, but look at your list from week 1 and 2. Pick some prefixes, roots, and suffixes, and try to make a few words with different cards, break them down into their individual definitions, and then try to figure out what those definitions would mean if we put all of our parts together. Remember, you don't always need a prefix, but you should always have a root and a suffix. Okay, one more practice slide. Let's look at the definitions and abbreviations for this one. So before you go forward, go ahead and pause your lecture and go ahead and write out the different abbreviations that you see in terms of if you were going to put them in longhand. So for each abbreviation, go ahead and write out the definition, and then you can follow along as I read and match it up to see if you got them all correct. So go ahead and pause now. Okay, hopefully you wrote out all your definitions for the abbreviations seen above. And so I'm going to go ahead and read it and check your work. A patient was sent for an ultrasound after reporting symptoms of abdominal tenderness and distension. A computed tomography scan was ordered after a routine biopsy of cells exhibiting hyperplasia. The ear, nose, and throat specialist revealed that the diagnosis of the patient was tonsillitis after they did not respond to the treatment. Go back and listen to that again if you need to. As a bonus, you can take some of the med terms like hyperplasia and tonsillitis and break those down into their component parts. Okay, so now that you've seen how the medical terminology can apply to an actual patient case, and you see how our prefixes, word roots, and suffixes all interact with one another, it's a good time to do some additional review. I highly recommend going to look at your flashcard groups, get some repetition, practice putting prefixes, word roots, and suffixes together and break them down into their component part definitions as well as the put it together definition. Just get yourself familiar with the words as much as you possibly can. If you have any questions on combining forms or definitions or how any of this works, please shoot me an email or reach out to me, and we'll set up a time to meet via Zoom or in person. Thank you.